Hello, scholars! My name is Dr. Kira Dillon, and the goal of this channel is to make academic subjects easier to understand. If you haven't already done so, please click the subscribe button so I can keep making videos that you like. Now, in the last video, we covered PTSD, and in this video, we're going to cover acute stress disorder. So let's begin. In order to be diagnosed with acute stress disorder, a person has to have the following symptoms. A person has had to experience a violation of their acceptable sexual norms, be threatened, or actually experience a traumatic event which brings them close to death, or have some very serious injury. With this, the person has to directly experience the traumatic incident. B, has to witness the traumatic event directly as it happens to the other person or persons. C, learn about the traumatic event happening directly to a close friend or family member. These traumatic events must be violent or by a car accident, which causes injury. Or D, the person encounters extreme or repeated exposure to the horrific event of the traumatic circumstance. This might mean a police officer coming upon the scene where people are dead or dismembered because of an accident. This might be a very traumatic scene for that police officer. B, the individual must have the presence of 9 of the following symptoms from any of these 5 categories, including arousal symptoms, avoidance symptoms, dissociative symptoms, negative mood, or intrusion symptoms. Arousal symptoms. These mean having trouble with sleeping, including falling asleep or trouble staying asleep, having poor quality of sleep, being irritable or having angry outbursts towards other people without being provoked. This can surface as physical aggression or verbal aggression towards objects or people, being hyper aware or sensitive about one's surroundings, having trouble concentrating, being startled easily by any loud noise. The next are avoidance symptoms, trying to avoid distressing thoughts, feelings, or memories. There might be attempts to try and avoid the people, places, activities, or situations that bring up the distressing thoughts. Dissociative symptoms mean being in a daze or not feeling part of one's own body, having an altered sense of what reality is, not remembering an important aspect of the event, forgetting a part of the traumatic situation. Negative mood. This means an impossibility of having a good experience, not enjoying other experiences because of the past traumatic experience. And then lastly, intrusion symptoms, having memories, thoughts, and feelings of the negative traumatic experience, having bad dreams centering upon the traumatic event and what happened, having flashbacks of the traumatic incident, having psychological distress over the traumatic event. These symptoms described before tend to arise from 3 days to 1 month after the experience. A life-threatening illness or a worsening medical condition do not tend to be a part of this diagnosis. The manner in which people present with acute stress disorder are different from person to person. Generally, most individuals will experience anxiety and re-experience the trauma to certain levels. Sometimes people will disassociate while they're trying to get through whatever experience they are subjugated to participate in. There can also be a strong sense of anger that comes from re-experiencing a phenomena. When individuals re-experience flashbacks or the event, these incidents will come on spontaneously. They usually come about due to a trigger of some sort, but don't have to. Individuals may experience noises more loudly or sensory information that was part of the trauma. Distressing dreams can also replay some of the trauma for that individual. Dissociating from the trauma can last from a couple seconds to even hours or days. Those dissociative states that last past 3 days are considered for the diagnosis of acute stress disorder. It's hard for people having flashbacks to distinguish between the moment of the trauma and their safe state in the present moment. Sometimes psychological distress is the most difficult piece of distress to deal with after a trauma. If someone sees someone that looks like their aggressor, or if something violent happened to them inside an elevator, that person or item can cause significant distress for the individual that's trying to put their life back together. This is why those individuals that know their own triggers will try to stay away from them. They may plan strategies to avoid these items or people so that they don't come face to face with what they fear. Sleep doesn't come easily for people that have acute stress disorder. It may be helpful not to watch the news at night or use alcohol to try and get to sleep. Individuals with acute distress can also be quick-tempered and become angry at little things. They may also have difficulties when it comes to concentration. These individuals might have a high startle reflex or response as well. Those individuals with acute stress disorder tend to have catastrophic or extremely negative thinking as related to events or even future events. Individuals who've been through traumatic events may feel guilty for its outcome and wonder if they could have done something differently. It's normal for a person to have panic attacks for a month or two after the incident. If a death was caused because of a trauma, a child might find themselves extra clingy and in need of attention. Headaches, dizziness, sensitivity to light or sound, irritability, concentration deficits, etc., can become symptoms that come along with acute distress disorder. Acute stress tends to take place in less than 20% of cases following a traumatic incident that do not involve brain injury. 19% tend to take place with assault, 13 to 21% with vehicular accidents, 10% with severe burns, and 6 to 12% given industrial accidents. Acute stress disorder cannot officially be diagnosed by anyone until 3 days after the traumatic event. If the symptoms stay for 30 days, it can be diagnosed as post-traumatic stress disorder. About half of people with acute stress disorder eventually develop PTSD. All right, well, that is the end of our video. I hope this helps to teach you more about acute stress disorder. I know it's not one of the most common mental illnesses out there. So if you have any comments or questions, please let me know and I will get to them as soon as I can. I hope you have a great day or night or morning for wherever you are, and I will talk with you soon.